Hey, it's April here. So, because it's Carnivore Month and I have not done anything for a long time, um, I'd like to discuss my diabetes and how I became carnivore. So, this year, 2025, I'll be 49, and I was diagnosed type 1 diabetic when I was 14 years old. At first, they thought I had mono, and I was quite sick actually for probably about 3 weeks or so. I grew up in a kind of a busy household. I had an older brother, and also, so I would have been 14. My younger brother and sister were um, like 4 and 3, so they were quite young. So my mom was quite busy, which is why I think I was sick for so long. So it was kind of, I didn't really have many symptoms. I was just sleeping a lot. I was drinking a lot of water, not really eating. I was just sort of throwing up all the time as well too. Really dry lips. And then one day it just happened really quickly. I remember looking in the mirror and literally I was skeletal. That same day, thank God, my grandmother picked me up, took me to the doctors. They did a blood test, finger prick, and my blood sugar, I believe, was 56, which is, I don't know what that is converted to the American numbers, but horrible. I think it was, I'm 5'9" now. I think then I was about 5'7", 5'8". Sorry, I'm 5'9 3/4". I'll hold on to the 3/4. But anyway, so I think I was 80 pounds. So it was bad. So basically I was sent to the hospital. I was there for about a week. I remember literally learning how to walk again because I had lost so much weight. I was dehydrated, unbelievable. Anyways, needless to say, recovered from that. And now here I am a million years later. But anyways, in the beginning, it was like I was taking the needles, multiple injections throughout the day, but the drawn back needle. So there was a lot of math, which I've never really liked. But it's weird actually. I don't really remember too much about how I ate. In the beginning it was just eat everything, eat whatever you want, just dose the insulin for it. I ended up moving out when I was 16 years old, which I know is crazy young, so that as well created a lot of mental stress. I don't even remember focusing on my diabetes, or everyone knew I was diabetic. I was never shy about that, but I never had control. I never had it as a focus or a priority, really. And then as life sort of progressed, a lot of different things happened. I'm actually a widow, but we had separated before he had passed away, so that created a lot of mental stress. I had symptoms of IBS. I don't know, there's just like so many different situations that I can remember that I was more focused up here. Like there was a lot of mental things that were happening. I lost a sister to cancer. She was 22 years old. Like and I was pregnant at the same time. Like there's a lot of different things that just brought me to a point where my body was not digesting anything properly. I think my nervous system was definitely shot. And then once you start to actually pay attention to where your blood sugar is at, like for me to get pregnant and to have my son, I had to have perfect blood sugar. Like sadly, I had had miscarriages in the past, and that was to blame. Bad blood sugar control. So to stay in a state of good blood sugar and dealing with a sister who eventually did pass away, right, frequently, weirdly, actually, within the same time frame of when my son was born. It's funny how things happen sometimes, and those are the things that I've also had to work on as well, is finding tools to deal with life situations, because once you're a mom, especially, it's a woman thing, not always, but you want to take care of everybody else. Your focus is to take care of everybody else. So you fall to the wayside again. But when it comes back and you can't go to work because your stomach is so upset, you're taking trips to the hospital because all of a sudden you can't see out of your eyes what's happening, and then you get eyeball injections for a year and 6 months. Like, it's actually quite traumatic to think about all the things that I've gone through because of bad sugar control. It's detrimental. And so it's my 35-year anniversary this coming year of being a type 1 diabetic. I want to prevent someone who's newly diagnosed and thinking that having your blood sugar over 6 or 7 is okay, because no one's invincible. And sadly, I've had some pretty bad things that I've had to endure. Sorry, there's my laundry, of course, and that's gonna go on forever. Anyways, yeah, if I can help somebody else to just understand that having good sugar control, and I'm not saying that carnivore, I haven't even really spoken about carnivore yet, but carnivore isn't always the answer for everyone. But when you don't understand what the problem is, and there's just so many things that are happening that it's hard to fine tune, the carnivore diet is a perfect way of a elimination diet. Basically, you're focusing on just one source that literally will feed every need that your body has, and you will thrive. You will be in more of a fat metabolizing system. So the benefits mentally, I've done low fat, high fat, now I'm like moderate fat, and I can notice the difference between when my body needs, actually when my brain needs extra fuel, or even when my body needs extra fuel. Like, when I'm using my body all day long, if I'm not thriving, if I'm not able to keep up with what I need to function in that day, I know that I don't have enough energy source, and my energy source is fat. That's why some days you can go low fat, some days you can go high fat. But when you simplify things and just have protein, it's just so easy to understand what's going on. And then eventually, if you're in a good place and you want to start to reintroduce things, then do that. Like, it's really that simple. But it's a way to really look at things almost black and white, because you've removed all of the different obstacles. You don't have the carbohydrates. Just for anyone, and I know there's a lot of people wearing CGMs, but as a type 1 diabetic, not only do you have to focus, I'm sorry, but that dryer is horrible and it's almost done. But when you're a type 1 diabetic, there's so many things that you have to consider. Am I going to go for a spontaneous walk? Okay, great. But am I going to have sugar with me just in case? Do I have a glucometer with me just in case, or my cell phone so that I can check my blood sugar? Like, you have to remember these things, because things can happen pretty fast. And sometimes we know a short walk can turn into a long walk, or a short drive can turn into a car accident, or blah, 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 blah. Like life happens. So you really have to be prepared. And when things are simplified, you remember these things and you practice these things and you start to advocate for these things, which is what I'm trying to do right now. Because we know that we're not the only one in the world. We're not the only one experiencing these things. And I would like to connect with other people and share my different experiences and just the positive outcome that I've had from following a carnivore lifestyle. And it's been it'll be 5 years this May. It's flown by as life happens, but yeah, it's just simplified things so much faster for me. And I don't know about you, but my schedule is pretty chaotic. So if things can be simplified, it makes life so much easier. And the reason that I talked about the mental connection was that I think a lot of the mental situations, or the things that I've experienced in life, that the mind gut connection is so huge. I heard a story once from a naturopath, actually, and she had said that sadly it was a relative of hers, but she ate everything organic, everything clean, everything perfect, was in the perfect environment, the perfect light environment, the perfect everything. But her parents were going through a divorce. She was in a really bad situation. There was kids absorb things. People, you know the vibe of the room. So this poor kid, but every blood lab she had, it's like she was eating the worst foods every day and got no sunlight, got no exercise, nothing, because she was in such a sad, upset, unsafe feeling in her brain, in her mind, in her thoughts. Her body absorbs that, and that creates a really negative environment. You don't absorb things properly. You react to things that usually you can eat, but eventually you can't eat. Like even water. Yeah, I used to eat salad all the time, and it was really basic, like iceberg lettuce, which is protein on top, with like oil vinaigrette. And I was so bloated, like all the time. It was horrible. Nothing seemed to help with that. I would exercise properly. I would eat what were the things, the complex carbs, all the things that you're told to do. But what needed to be fixed was up here and down here. Down here needed to have a rest. Up here needed to be helped. And high blood sugars, that in itself creates this almost like electric shock that's happening in the brain that causes almost brain damage. Like it's mind-blowing. But and I'm not a doctor, I am not giving medical advice, but I'm just reflecting on a lot of the things that I've seen, heard, read, experienced myself. And honestly, just the simplification of my life has just improved everything across the board. And once you start to put those pieces together, you become more calm and relaxed and just chill, and you appreciate things way more. And honestly, connecting with the circadian part of life has improved a huge amount of things in me. You just start to notice a lot of things and connecting with nature, and you then want to connect with people, and you want to share your story, and then the positive outcomes that they can have and that they do have and that they share with you, and then it just reinstills all that extra connection, and it's awesome, and it's amazing. But along the way, you also need to find different things that can calm you, relax you. Sometimes there are traumas that you have to dive a lot deeper with, that require a lot of extra work. Um, and that's a whole other subject altogether, but it in itself requires work. And um, honestly, there is a lot out there that I have found that has been eye opening, and just even your curiosity, just you can explore so much, and you can learn from so many different people. And if you even have, I would start off with, everyone suggests 30 days, but even try one day, especially as um, a type 2 diabetic or a type 1 diabetic, or just as a person, just noticing how your mood improves, or how your day improves, or how your waist improves. Like, yeah, it's awesome. But anyways, I'm done talking, and my dryer is done annoying the entire world. But yeah, I just thought I'd come on here and blibber blabber about a million different things about being a type 1 diabetic, being a carnivore, or low carb. Like, I've done it all. Carnivore doesn't have to be the answer for everyone, but if you want to figure out what's going on the fastest way possible and feel amazing and have predictable everythings, then I invite you to try carnivore.